prevent your body getting a shock to the system.
That's it. I was trying to think about it. Thank you. So the best, no, wait, what was I saying? Hi, my name's Baz and I'm a mental health pharmacist. The last video we spoke about psychotic depression. In this video, I want to debunk 6 myths with you to do with mental health and medication. So the first myth is that if you get diagnosed with depression, you'll be on antidepressants for life. So some people might need antidepressants indefinitely, but others might only need it for about 6 months to a year. And then the antidepressant can start to be withdrawn slowly. The second myth is that antidepressants are a quick fix for depression or low mood. So I explained in another video how antidepressants work, and in that video I explained that it can take about 4 to 6 weeks for an antidepressant to actually work. So it's important to know that if you are being started on antidepressants, it's not necessarily going to work straight away. You might not feel better straight away, but the plan is that over a period of time you should start to feel better. So the next myth is that antipsychotics are only used in people with schizophrenia. This is a myth. It can be used, as I explained in another video, in people who are experiencing psychotic depression. It can also be used in other mental health conditions such as bipolar, sometimes OCD. It just depends on how somebody is presenting. Another myth is that you can't use antidepressants or antipsychotics if you're pregnant. When I was working on a maternity ward, I came across a lot of women who just stopped their antidepressants suddenly, and this can actually be quite dangerous for mum and baby. So it's important that if you're on antidepressants or antipsychotics, that you speak to a healthcare professional first if you're planning to get pregnant or you are pregnant before you change your medication, because there are some medications that can be taken whilst pregnant, and it might be that you just might need some extra monitoring. So another myth is that if you need mental health medication, then you are weak. And this is sort of to do with the stigma around mental health. You definitely aren't weak if you need mental health medication. Sometimes, if you're depressed, things can get really difficult and you just need something to sort of boost you out of that rut. Equally, if you're experiencing a psychotic episode, you might need something to help balance that chemical imbalance in your brain. It's really important to not associate taking medication with weakness. You wouldn't say to a type 1 diabetic that needing insulin makes them weak, and it's the same thing with your mental health as well. And the last myth is that mental health medication is addictive, and this is a question I get asked a lot by patients because they get really worried that they're going to get addicted to their mental health medication. Antipsychotics, antidepressants aren't addictive. There are some medications that are used in mental health that can be addictive. So things like diazepam, which belongs to a group of drugs called benzodiazepines. And sometimes these can be used for insomnia or anxiety. Those are very addictive. Antidepressants and antipsychotics are not addictive, but they do need to be stopped over a period of time. They shouldn't be stopped abruptly. And that's just to make sure that your body doesn't get a shock to the system. So those are the 6 myths. And then in the next video, we'll be talking about sleep and mental health.